And Cradle Cincinnati has been working for several years to reduce the number of infants who die before they turn 1. And this morning, the nonprofit has some good news to report. Meredith Shockley-Smith is here via Skype to tell us all about it. Good morning, Meredith. Thanks for joining us. We appreciate it.
Good morning. Thanks for having me.
So tell us about this good news that we're seeing in your latest report about infant mortality among Black infants.
So it's really exciting this year. We get to report that the lowest numbers of Black babies died this year. We went from 59 down to 45. And while that's really exciting, it's also still not perfect.
Sure, but the reduction, it's good. It looks like we're going in the right direction as far as the numbers go. So to what do you attribute that reduction in the number of deaths?
What we are doing in Cincinnati is really exciting about asking Black women what they need and then centering them as leaders in that so that they can create the change that they see fit. So often we make the assumption that others have the answer. And I think that what Cradle Cincinnati chose to do by naming racism as an issue and then really allowing Black women to lead has been quite the difference.
And it's my understanding that there was a focus on a few different neighborhoods when looking at this. I think the Roll Hill area had a reduction in things like that. So is there a geographic component to this, or are babies in certain neighborhoods at greater risk?
Sure. Well, we see Black babies across the board, no matter their educational attainment, no matter their economic attainment. We see Black babies dying across the board at the same rate. And so there are some concentrations of neighborhoods in Cincinnati where we focus, and we saw some reduction in Price Hill and North College Hill, and in Winton Hills. Almost lost that one. But we also saw it across the board. So there's often geographic, but it's not specific.
And we've heard a lot, even with the coronavirus, about the health disparities, the coronavirus hitting the African-American community and other communities of color harder than white communities. So this almost seems to be a little bit of an extension of that, just showing that racial disparity in healthcare.
Exactly. When you just think about racism in general, it hits across the board for Black folks. So the perfect example is when you have this happening with infant mortality, and then you see something so large, a global pandemic, and you see it happening there. You get to talk about race and racism and how it's really impacting the individual across the board.
All right. Well, Meredith Shockley-Smith from Cradle Cincinnati, we thank you so much for joining us this morning to talk about this. It's an important issue, and good to see those numbers going down. Hopefully, we'll have you back another time when we can say that no babies died before age 1. That would be great.
That would be. Thanks for having me.
All right. Thank you.